Fantastic. Okay, well, it's 4 minutes past. I think we better crack on because I don't want to run out of time. So, so welcome everybody. Really warm welcome. This is the first webinar that's been hosted by Simply People. For those of you who don't know, Simply People is an occupational health community and platform that I'm working with Danny currently at the moment to develop, and we aim to help providers with their continuing professional development through events such as this and other similar things. We provide support and the opportunity to network with other occupational health and wellbeing providers, and obviously generating new business as well, because the platform is based on a fairly powerful and granular search engine that will allow clients to find your specific services and skills and expertise. So if you haven't visited our website, we've just recently upgraded and relaunched it this week, actually. So please check it out and register us as a provider if you haven't already. That's simply-people.co.uk. And yeah, at the moment, the platform is free to join. So, you know, we'd love you if you'd sign up. But I'd say it's the first of a series of webinars. So I'll talk a little bit more about the other ones we've got coming up at the end of today's session. But yeah, for today's session, I'm going to hand you over to Clare Henson-Bowen and Colette Owen from Bespoke Well-being. And thanks very much to them for this session, and hand over to you.
Right, thank you, Charlotte. I didn't realise we were the first, so thank you very much for having us.
Yeah, absolutely.
I was just going to say, if anyone has any questions at all, I know everyone's muted, aren't they, Charlotte? So if they have any questions, you can pop it in the Q&A function or the chat. I've actually got the chat open, but we'll try and answer those at the end. So if there's anything that we say that you have any questions about, or anything that we don't say that you want to ask, then please, you know, do drop it in there and we can answer at the end. So thank you so much for having us. We'll tell you a bit about Colette and I in a minute, but we work at Bespoke Well-being, which is a occupational physiotherapy and ergonomic company. So we're based in London, but we cover across the UK. And I've met with Danny a few times, and I think one of the reasons he's really keen for us to come on here, because we have been messaging out about home working for, since COVID struck, really. We've been working with employers for a long time in occupational health companies to help support staff with musculoskeletal disorders and doing DSE and ergonomic assessments. And since COVID hit, obviously everything has changed. There's a lot of home working that's now happening, which we'll talk about. So we've personally had to shift a lot of our services to help our customers and to deliver the support that their workers need in the home setting. So that's really what we're coming to talk about a bit today. If my screen will change. 2 seconds. Oh, there we go. Had to take the chat away. So I'll just hand over to Colette just to say a little bit about herself first.
Okay, so good morning, everyone, and lovely to see so many different job roles and places. So no, thank you all for coming. So my name's Colette Owen. I'm clinical director at Bespoke Well-being. I have, it always makes me, I have over 20 years experience in the physiotherapy sector and specialising in musculoskeletal disorders, so aches and pains. Worked in the NHS for many, many years, managing services as well, and also do an awful lot of ergonomics and occupational health. As Claire's mentioned, since March, we've been, predominantly doing online services, which we'll talk a little bit more probably throughout the presentation, and they've been working really, really nicely.
Thank you. So my name's Clare Henson-Bowen. I'm the founder at Bespoke Well-being. I've got over 15 years experience in musculoskeletal health, but also my passion is around chronic pain and occupational health and ergonomics. So I did my postgraduate diploma in occupational health policy and practice, which completed 2015. But also I spent a lot of time in an embedded NHS occupational health service for about 7-8 years within a big teaching hospital in London. And then in 2014, I started Bespoke Well-being, so sort of transitioned over into the private sector. We've just put our contact details there, so if anyone would like to contact us afterwards, have any other questions that they can think of, do reach out to us, that's no problem. It's slow on the slide change, sorry guys. There we go. Right, so the aims of the session. So we're here to talk a bit today about how can we support these home workers. So looking at the tips and the pragmatic suggestions on how we reduce and minimise musculoskeletal disorders and how we establish kind of good working practices. So in the presentation, we're going to be talking about, first of all, just setting the scene for home working. I know a lot of you already know that it has increased, but we're just going to set the scene a little bit more about what that looks like at the moment. We're going to be talking about how the home working way of working is impacting on the musculoskeletal health of employees here. What are the most common musculoskeletal disorders associated with home working? How can we effectively manage the home workers? And this is a big one really, because it is quite new to a lot of employers and a lot of occupational health services. So how are we actually going to manage these home workers and their assessments? What occupational health support is out there? So obviously a lot of you do already work in occupational health, so you'll know some of this stuff already, but it's just to summarise there all the different things that are available to customers out there. And lastly, other education and exercises to promote health. So other things that we've kind of been reading along the way, haven't we, Colette? That we want to just direct you to, that you can go to get further information. And then lastly, we'll look at the Q&A. So if anyone has any questions about what we're saying or wants to ask us anything at all, then you can pop it in there. So first of all, let's just set the scene. So before COVID came along, it was estimated only around 5% of people were home working majority of the time, okay? You know, which is quite low in comparison to people working in, say, offices where everything is kind of hopefully largely set up for them. However, since COVID has come along, we've had this rapid increase in working from home, and it's estimated that over 71% of people are now majority working from home. And it's important to recognise that massive increase, but also the speed at which that happens. Our clinics, we have 4 London clinics. We closed our clinics down in about 3 days, didn't we, Colette? You know, people in London in the offices, our commuters, within a week they weren't at work anymore, they were working from home. And so some people didn't even have chance to grab any of their equipment. Employers didn't know whether to send them home with equipment or not. All the offices sort of shut down. So this happened really, really quickly, and clearly at that time there was a lot of other things going on. You know, HR were looking at furlough schemes, people were worried about job security, people worried about their health, people becoming unwell. There was a lot of other things that were happening around that. And when people started working from home, it was very clear that a lot of people are working in kitchens, in living rooms. They're working in suboptimal environments, and we have seen it all because we do a lot of our sessions online now, online assessments, and we've literally seen everything, haven't we, Colette? People working. We saw a lady sitting in her kitchen with the cupboard door open and her feet inside her plate cupboard. So people are literally working in all these different crazy environments. And for a lot of people, they're balancing a lot of things with their working. So they're balancing childcare, they maybe are caring for other people and looking after their own health. Perhaps they've been unwell, they might be struggling with long COVID. So there's a lot of things that are going on. And important to note, the health and safety and exec guidance around home working in the initial stages of COVID, they did sort of take the stance that we didn't need to, you know, it wasn't essential that home workers undertook another sort of DSE health and safety assessment. But as time has gone on, you know, this is becoming a longer term arrangement for a lot of workers. It's been 6-7 months for a lot of people, and the guidance is shifting and changing, and a lot of employers are looking at closing offices, or they might have already closed offices. They don't have any plans to return to an office environment for quite a long period. So we need to look at what is the future of home working as well. As we talked about the longevity of it, flexible working practices and blended approaches. So a lot of offices, particularly in London, you know, these big expensive offices, they've realised that they save a lot of money as well if people, you know, they're not paying for these office blocks, but also people are working very well at home a lot of the time. So they're looking at, in the longer term, next year, actually, are people going to be, you know, 2 days in the office, 3 days from home, having this flexible working choice and practice for their staff, and having these blended approaches to the way in which we are working. So what is the impact on musculoskeletal health?
I think this is me. Yes.
Oh, is it? Am I stealing your slide?
Honestly, yeah.
Stop me talking. Right, go on then.
Your moment to have a sip of tea, Claire. Okay. So yes. So what we need to do first of all is, as Claire rightly mentioned, there's been a massive change in the amount of people who are now working from home and the impact they might be having on their health. So before we look at that in more detail, we need to understand a little bit more about pre-COVID. So this information is from the Health Exec, so HES, and again, it really shows very clearly, and this is from their data from 2019 to 20, so I think it stops just before March. And usually we think about 1 in 5. So their data for the past few years suggests that 1 in 5 workers in Great Britain will have a musculoskeletal disorder. What's a musculoskeletal disorder? So this could be neck pain, back pain, injuries, post-surgery, could be pins and needles, could be numbness, could be something long-lasting like osteoarthritis. So it's a very, very big umbrella, but it usually is about 1 in 5 people. That's around 480,000 and 8.9 million working days. But it's the little donut ring below, which is quite compelling. So they've put it down into affected areas. 44% of upper limb or neck, so upper limb would be shoulder, could be elbow, could be wrist. 44% of those people reporting musculoskeletal disorders was upper limb or neck. 37% was for the back. Okay, so bear those figures in mind. Claire, if you go to the next slide, please.
Sorry, it's just a bit slow. There you go.
There. And as we were saying, it's usually 1 in 5, but what's been really interesting is over the years, the last 20 years, you can see that there has been quite a nice decline in workers reporting musculoskeletal health. And there's a variety of reasons for this: better health and safety, better understanding, workplaces are generally safer now as well. I think there is more flexible working. I think occupational health is probably better provided, so there's a quicker access to services. So all these various factors are coming in, and we're starting to see this gradual decline in new and long-standing musculoskeletal disorders, which is really, really encouraging. Next slide, please. However,
sorry. Little slidey bit. There we go.
So, however, since COVID, we are seeing a change in this. So the slide on the right is the previous slide, just to let you remember what those figures are. But and there's a couple of nationwide surveys which are supporting this. You've got the Institute of Employment Studies, IES, who've been doing a study pretty much from March, as soon as it began. And then you've also got Versus Arthritis, who did a nationwide study, and they published their results in September this year. And they're both saying similar things. So if you look at the IES survey, first of all, this was to employees who are now, just asking them, what are you doing now? A significant increase in MSDs, as Claire mentioned earlier. Over 70% of people are now working from home as well. But this is the really interesting thing, the percentage increase in neck, shoulder and back. So from our HSC data, it was about 44% and 37% respectively. Oh, hello, okay, I am. But now we're seeing that that's really rapidly increased to 58% and 55%. And I think the rapid increase in this is really, important. There has been this gradual decline. We've now seen a sharp upward turn in the amount of MSDs that people are now reporting. With that, they also reported that they were exercising less, and we're going to talk about this a little bit more as well. So 60% exercising less, and other factors, so poor sleep, poor diet, more alcohol consumption, increased stress was mentioned as well. And from working with MSD, there's often more than one thing which can impact on somebody getting an MSD, and that mental health and physical health are really closely related. The Versus Arthritis, again, supports that 4 in 5 since home working now report MSDs. So as I was saying earlier, it used to be 1 in 5. So now we're going up to 4 and 5. This is really compelling. Of those they surveyed, 80% have not actually reported these MSDs to their employers. And of those, 46% were becoming more reliant on pain relief and painkillers. 1 in 3 had received no advice from their employers regarding working from home, providing any kit or even support. So again, both of these things are really closely related, and we certainly see that. So just to recap, a rapid increase in MSK disorders, particularly within the neck and the back. Of those, 80% are not reporting it to employers, and also 1 in 3 reporting that they'd have no advice from their employers regarding working from home or support. And this really relates back to what Claire was saying earlier on. We are very aware that these are very unusual times, and the boundaries are changing all the time with what we should be providing, and if we're in lockdown and if we're not in lockdown and what tier we're in, job security as well. So we are very aware that, you know, HR and occupational health and employers in general having to juggle so many things at the moment, and the priorities are just changing on a day-to-day or weekly basis. Next slide, please. So why are MSDs increasing with home working? As I alluded to earlier, MSKs are complicated, they're multifaceted. Often it can be related to how you're feeling in yourself, but also it could be very innocuous. So one person can sit in a poor situation and have no symptoms at all, others in the same situation and can feel symptoms. So it's very individualized as well. The suboptimal work conditions are going to be key. So our figure on the right is showing us how we should be if we're talking about ergonomics and good working postures. But in reality, from what we're seeing, this isn't many people who are able to replicate this for, again, the reasons we mentioned earlier. Part of that is lack of equipment. We're talking about really basic things here as well, like a chair and a desk for many, many people, before we even get into laptop risers and keyboards and, you know, mice and all those things. It is often the very basic equipment that people just don't have. So they are working from their kitchen desk, kitchen table, often on their bed. Often, you know, they're really struggling because of their Wi-Fi as well, or it's a shared household, so you've got lots of different people fighting for the best space within the house. So there's lots of different things going on. If they are lucky enough to have a table and a chair and some basic kit, it's then what we're seeing is this lack of knowledge for actually setting up. So when you're in that office environment, we often know that our facility managers, our health and safety, our OC health, they've got all this set up for us. All our desks are the same height. We have variable height chairs. We have, you know, most of that kit already there. It's always been a bit patchy who has DSC assessments and not, but there is that general feeling of, if I go into work, it's all set up for me. We're now taking people out of that familiar setting and putting them in, and there's a lot of assumption that they have some of that knowledge already. Another massive thing we're seeing, which personally I think is a big factor involved in why MSKs are increasing, is this change in behaviours. When you're working from home, it's quite difficult to know where the beginning and the end of your day starts, because it's so easy. We can just, you know, tap away and then suddenly look at the clock and, gosh, it's 6 o'clock, what happened? There's none of those routines in place. So we're not commuting. So we're not going to the train station. We're not running for the bus. And we're not doing that on the way home. We're not having our set lunchtime. So we're just often just working through lunch. And even if we did that at work, you would often have to get up and get your lunch or walk to the nearest cafe or Pret or wherever it may be. Lots of changes of behaviour. The other key thing is that we're all using Zoom, hello, or Microsoft Teams or something similar. And what's happening is that it's very easy just in your diary to have consecutive meetings with no breaks in between. If we were in an office setting, we'd be walking to those meeting rooms, or would be walking to our colleague, or walking to see clients or visiting clients, and that's not happening. So often, you know, I talk to lots of people and they're just saying, gosh, I've got so many meetings back to back, I'm not even having time to quickly nip to the toilet or get a glass of water because, you know, I haven't got that natural break in the day to do that. So again, we're just sitting down for longer and longer. And it was very key earlier how they mentioned that 60% report that they're doing less exercise. That doesn't need to be, you know, playing football with your friends or going to do that class at the gym. It is often just, you know, walking to the station or walking to get your lunch. I'm, you know, making myself do exercise, and I often compare my step count, and my phone is very keen to tell me that it's probably half of what it was this time last year. And it's purely because I'm not commuting into work. I'm not walking to all these different places. So these real change in behaviors. And we then also have, as we spoke about earlier, the higher stress levels, the decline in mental health. Again, you know, a little potpourri of all these different things going on. And obviously a lot of people are on furlough or are having to look at redundancies, and just being at home with people who you might not be at home with all the time, and the stresses of school and childcare and all those other bits. So all those combined, it doesn't necessarily surprise me as a clinician who's worked in this area for many, many years, why we're seeing an increase in MSDs. Next slide, please, Claire. I think this is you. Back to you.
Have my tea now. Cool. So thanks for that, Colette. And so next up, so how do we effectively manage these home workers? Well, I personally feel a lot of it starts with a policy. We love a policy, don't we, Colette? But really that is where you as an employer or the occupational health service, or, you know, working with that employer or supporting an employer, has this detail for your staff. So whether you already have a DSE or a health and safety policy that you can embed some of this home working sort of risk assessments into, or how you're going to manage home working. If not, it'd be a good idea to perhaps have an independent home working policy. So it just depends on how things are set up for you. But in there, it should be, you know, how you're going to manage things, how people do access the risk assessments, and what they do, who they contact if they are having problems. Okay. The next thing, which we've been quite heavily involved in with a lot of our customers, is drawing a line in the sand and just getting a baseline assessment done on everybody. So if you think here about just a really basic, like a self-assessment tool almost, DSE assessment, getting people to assess their own home working environment, similar to you do in an office, sort of a basic checklist style assessment, just to find out where everyone is up to. Because as we said, this all happens so rapidly, and you've had this massive change from 5% to 71% plus people now working from home. So to find out what environments are they in, what kit do they have, and as Colette said, it's the basic kit as well. And you know, what have they got available, and is it suitable? Are they having problems? And give them opportunity to raise concerns, and maybe mention if they are having any musculoskeletal ill health. So as Colette said, 80% of people haven't said to their employer that they are actually having an issue or are struggling with this. And we've done this with a number of customers now, and we've sort of helped them with that, because we talk a bit about this a lot, don't we, Claire? People feel that the DSE assessment is really overwhelming. It's going to open this massive can of worms that they just don't want to deal with. And actually, it doesn't have to be as complicated as that at all. You know, it's a very, you know, people can self-assess themselves. I think where people struggle, which is why we have designed a slightly different service to help people, is what do the employer, what do you do with that self-assessment? So they filled it all in, it's made loads of comments, and there's things that they're struggling with or they feel they haven't got. It's then someone has to go through that. So you have to have someone suitably experienced and trained to actually go through those self-assessments and decide what to do. And as soon as you start getting 20 staff, 50 staff, 1,000 staff plus, it's a tall order, isn't it? It's you know, you're trying to work out how on earth do I manage all these things. But I would say around 80%, 85% of people will be just fine. They might not have all the kit they need, the standard kit, like Colette said, a desk, a keyboard, you know, the basic things that, you know, we're trying to make the home office as much as close to an office-based environment as you can. you know, they just need those things, and actually they're fine, but they just need these, you know, to be set up a little bit better that way. And then you have these people that, you know, maybe their stature is outside of norms, so maybe they're really petite and they're working off a tall dining table, so they need a footrest, or, you know, something. It's not too much in way of ergonomic equipment, but they just need something a little bit additional, so sort of in like an amber kind of category. And then you'll have probably 8%, if that, of people that 8 to 10%, I guess, who might need a bit more input. So maybe they have underlying health conditions or injuries that actually they're really struggling. Maybe they have got all the standard kit, but they're still really you know, having, with what Colette said, all these other factors have had a negative impact. Perhaps if someone had you know, arthritis of the neck, and actually with all those changes in behaviours, a bit more stress levels, less active, and actually their, you know, pre-existing MSD has got a lot worse. So people might need a bit of additional support and additional assessment, and potentially additional equipment or work adjustments. But we're really keen on employers, you have to know what's going on. You have to get kind of that baseline data. If you don't have that, you're going to be sort of dipping in and doing like little bits here and there, and you're not going to be fair across all workers. People aren't going to know where they stand, they won't know who to go to if they're having a problem, and you're just kind of patching little plasters everywhere. You kind of need to find, okay, draw that line, where is everyone at? And the reports that we've done, we've been really proud of, because what happens is the employer gets a report back, and it will have the statuses, so it'll have a list of everyone, all the different elements of the DSE, and it will say, right, this person is green, no further action is required. These ones are amber, they're going to be all right, but they perhaps need these basic bits of kit, and these people are red, you need to do something a bit more with these people and delve deeper and find out, you know, get more support with those people. Next up, training and education. So as we mentioned before, when people go into an office environment, everything is kind of there for them. They have that height adjustable chair, the desks are all largely 72, 73 centimetres high, you know, they have a monitor screen quite often, they've got a keyboard and mouse, they have all the stuff. They go to meetings, they have a set lunch break, they go off with their friends down to Pret for their lunch. It's all kind of, the behaviours are there, it's ingrained, the culture can come across really nicely. Put people into their home environments and they lose a lot of that. So they have to be more assertive and be more strict with those routines. And they have to have a good understanding of good working practices and how to set up and sort of do that self-assessment if that's how you're going to do it. Because dining tables, for example, are typically a lot higher. They're 76, 78 centimetres high. A lot of people are working on dining tables. It's all different, and it's the controls all over the place. So for them, those sort of risk controls to be there, they have to understand how to do it, or they need help to understand that and get the advice. And I've just put in there looking after mental health as well. So we do a lot of work with our customers in our training webinar to staff around avoiding isolation, you know, having sort of still doing social things online where you can, taking walking meetings, so getting active and moving about, where you don't need to see people on a video screen, for example. Go and have a walking meeting, put your headphones in and go for a nice walk. And yeah, working practices to avoid isolation, keep people moving. So it's really sitting a lot with the employee, but the employer can do an awful lot the way that they structure things within the work demands that they're placing on people. So we chatted with a company last week, and they've decided to make all meetings on Zoom or Teams, they have to be 45 minutes. And they have to start on the hour, so that everybody gets a 15-minute gap, a 15-window gap between each meeting to move, go and get a drink, go to the toilet, you know, whatever they need to do. Because as Colette said, a lot of people are just go back to back with their meetings, and they've recognised that this is really bad practice, and it is a good way to try and help people to have that little break and to micro break and get up and move around. So occupational support out there. There is a lot of occupational health people in here. So I don't want to teach a lot of you to suck eggs, but I've just listed a few things there. So of course the health and safety exec do have a lot of information out there about DSE and self-assessments and home working, and they've got the advice and the documents there, and a lot of our customers do use those in the first instance if they want to. They've maybe got smaller teams, or they've got someone in-house that can help them collate the self-assessments, or they're using the self-assessment tools checklist to devise their own ones. So we reviewed one for a company this week, didn't we, Colette? So that is there, of course. You can get support with the DSE and the ergonomic assessments, and we tend to look at this as two types of assessments. So the DSE, we look at that more as like the checklist. So people that aren't necessarily having any difficulty, they don't have underlying health conditions. It's that kind of finding that baseline, getting the checklist of the environment, what kit they've got, how they're managing. And then the ergonomic assessments would be a more extensive assessment of people who maybe are pregnant, they have an underlying health condition, or maybe they've been through the DSE, whether that's a self-assessment or with a company such as ours. But actually it has flagged them as red, and they've almost not been able to overcome the risks and the issues with the DSE. We then go in and look at the ergonomic assessment. And these can be done in a variety of ways. A lot of companies are doing these remotely now, so online via video, self-assessment forms, webinars, and of course there are face-to-face options for ergonomics. You're unlikely to get someone to do a basic checklist DSE in home visits because it'd be financially not viable to go around to everyone's house for a quick 20-minute check. But the ergonomic assessments, is an hour with the employee and a bigger report and equipment recommendations. So you can still get those face-to-face if it's, if the risk is outweighed and we feel we need to. But to be honest, we are getting really good outcomes with our video sessions as well. So there are a few options there for people. Occupational health physiotherapy, got to put that one in there because that's our bag. So you might want to consider whether you need the support of occupational health physiotherapy. So there clearly are a lot of staff out there who are struggling with MSDs from the home working that has happened. As Colette said, 80% haven't actually flagged it yet as a problem, and we're seeing a lot of this. People getting gradual onset of neck and shoulder discomfort, but also I don't want to bring my husband up in every presentation I do, but he sits in a terrible way, and it really upsets me sitting in my nice office with my standing desk and my chair and everything. But he pulled his back just bending over for something else 7 months after sitting in a rocking chair with his laptop on a wash bin. And so people are, they're having quite acute attacks of pain almost because they've been sitting in terrible ways and everything's just been gradually getting stiffer and more tight, more sore. And then it can just be a little thing and it's, it's really, really acute. So if you have anyone that you think actually we need to offer this person support, then again, you can access occupational health physiotherapy. The online sessions for physiotherapy are done via video with us, and lots of other companies are doing telehealth options as well. And you can buy, packages of things. So a lot of these workers that we see sort of 3 or 4 times. So you can buy like a little package, and quite often, because we're seeing them in their homes, we can say, look, send us your photos of your DSC station, show me with the video, and we can have a look at things, and we can always make suggestions, and we go through those good working practices and behaviours with them as well. Then, of course, we've got the occupational health management referrals, which I guess a lot of you are involved in. So you've got occupational health physiotherapists, occupational therapists, you've got the nurses, and you've got the physicians. So again, don't want to teach you guys to suck eggs, but if you have someone that has an underlying health condition, or you're concerned that health is impacting on work or vice versa, then of course you can send through a management referral there and ask your specific questions of what you'd like to know, and they can assess that for you and respond. And I'm pretty sure a lot of occupational health providers, nurses and doctors are also doing video and telephonic consults during this time. And lastly, we've got the EAP kind of mental health support. So as lots of you know, the MSDs are really closely linked with mental health and vice versa. So just making sure that your staff have a forum, communication pathway with their manager, perhaps to voice any concerns if they feel happy to do so, but also through occupational health and potentially EAP that they can access support should they need it. Really, really super important at the moment. And I've just put the Simply People website in there because I know you guys have just revamped it all. So the idea of Simply People is around showcasing different occupational health services and providers. So Danny and I have talked about this quite a bit. Sometimes employers and managers, they don't know what they don't know, so they don't know what they need. So the point of the platform is to help to showcase these professionals, so that you can, if you're a professional signing up, for example, and you're putting your listing on there, you can maybe link with some of these things, so that when an employer comes on is trying to find out, okay, what do I need? I've done a basic, DSC, I've then had an ergonomic assessment, but actually this person's having sickness absence, really struggling. They might then go, right, I need an occupational health nurse or physician, for example. So that's kind of there. So Simply People is there for employers and managers to find what they need, but also for occupational health professionals to showcase what they do so that people can find them.
Just to jump in, Claire. Oh, sorry. Yeah. So just to jump in, I mean, we've spoken a lot today about video conferencing, and we're all sitting down. One of the brilliant things about using video conferencing is how rapid and easily accessible it is. And we've very successfully, and I know other companies have as well, have introduced this into our physiotherapy and ergonomics. So I think since March, we've almost seen 4,000 online sessions, whether that be physiotherapy or ergonomics. And this is the beauty. So when we talk about occupational health support, it is there. And one of the key things we do know about occupational health is the quicker you can get somebody to see a healthcare professional, or the quicker you can manage the problem, the better the outcomes. So again, it's just, we've spoken all about sitting is bad and, being inactive is bad. But actually, video and online stuff can be really, really successful. And it's global. So knowing that we have some, people from Asia Pac, we've seen people all over the globe online, which we wouldn't have been able to beforehand, because it's a bit of a long way, South Africa to London for a physio assessment. But we've been able to offer that. And again, there'll be other companies out there. So I think that's a really key thing, is that a lot of this support can be provided very, very quickly. And often, as Claire also said, we're seeing people in their own environments. So actually, a lot of the stuff we're doing is immediate. So you need to do this with your chair. Let's try and do it now. Let's teach you this exercise you can do in your home setting. And we're having really great outcomes because the stuff we're giving is realistic. Often they don't need any special gym equipment, and the changes we're making can often be very, pragmatic and sensible and immediate. So that support is there, and it can be very rapidly given.
Thank you. Brilliant. I'm just conscious of time, but I just wanted to put these other kind of places that you can go to access any information around home working. So of course, we've already said the HSE website is there. The ACPO Association website also has now added home working advice and support through their website. I don't want to try and do the abbreviations. Association of Chartered Physiotherapists in Occupational Health and Ergonomics. There you go. Phew. Had my cup of tea. You've also got SOM is there. They've also released information. As Colette said, Versus Arthritis has done the survey, but also they have lots of stuff on their website that you can access. You also found, Colette, that they do a 30-minute free workout every week with, what was it?
Personal trainer,
Leon. Yeah. Might check that out. So yeah, that's there as well. And we also have, right at the very beginning in March, we very quickly put together a home worker guide. It's like a 2-page PDF that we sent across to our customers. They could just disseminate an electronic advice sheet to their workers, their home workers. So if anyone would want that, do just email us. It's not a problem. I'll just forward it over to you. So yeah, that is there, and it just goes through good working practices and things like that. So yeah, that's all our bits. So Q&As, any questions? Charlotte, I'll hand back over to you. Is there any questions?
Yeah, thanks. So nothing's been typed up as yet, but please, anybody, now that the Claire and Colette have finished their formal bit, if you do have any questions, please just type them up either in the Q&A bit or the chat. I guess I had a question. I just wondered what the impact has been on you, you two, like having to work remotely, because I would have thought, prior to COVID, we all thought so differently, didn't we? And I'm sure you would have thought trying to do things remotely just won't work for what I do. I have to be there. I have to be with the person. So how has the last 8 months, whatever it is, changed your professional practice, I suppose?
Yeah, I mean, obviously, I was actually on holiday when this all started to kick off. I was in the Caribbean, and so I was lying on my sun lounger on my reading the Daily Mail, and could see all the patients coming out of the clinics, cancelling all their appointments. And so it's been a strange old time. We didn't really do any online video work before COVID, so for us it was all super brand new, but we had a lot of customers and a lot of patients that we still had to support. So we very quickly moved over to online. Within days we were set up, and obviously we've had to tweak things and review things as we go on. We're continually doing that even now, but we've been really pleasantly surprised, haven't we, Colette, how the outcomes that you can get and the positives, and particularly with the physiotherapy side of things, because everyone associates going to a physiotherapist, lying on the treatment couch, having a massage, and essentially we are, Colette and I, both very manual therapists as well. We like to do those techniques. But what we're finding is that people that are coming to see us online, they are really engaged and they're really grateful. And we can still do, I'd say, a good 80% of the assessment via video, getting them to help us with palpation and doing tests using walls and different movements and copying us. And then we use an exercise rehab app to send all their program through, so they've got all the videos and they can track it all, which we weren't using before in the clinics, and they're loving that, and the compliance is great, and they're taking a real control of their recovery, because they're not reliant on passive measures, so they can't, they're not relying on us massaging them or taping them or acupuncturing things, and so when they're getting better, which they are, a lot of them are, they're sort of feeling like they've accomplished that themselves, because they've taken on the advice and education and the exercises, and they've done it themselves. And I think Colette said on another session we did recently that, when they're sort of palpating and moving things, we're getting them to describe, how does that feel? And so they're more in tune with their bodies. So we've it's all very new to us. I say new, we've been doing it 7 months now, but we've been pleasantly surprised, actually. Yeah,
no, I'd agree, and I think, from as Claire said, we were both manual therapists, but that wasn't all we did. So we were always very open to different ways of working for different client groups, and I think online has just makes you look at your own practice and actually think, I can do this differently. And so it's been, on the whole, a fairly enjoyable learning process, because you're looking at the situation, and your favorite test you can't do anymore because you're not there. So it makes you think, well, how can I still get the benefits of this test or this treatment? How can I involve the patient? And both of us involve our patients an awful lot anyway, because that's what you should be doing. Patient-led goals and our subjective assessments are always the bulk of our assessments, but it's made us involve them even more. And we've both noticed that we're pretty sure that one of the reasons our outcomes are good and very good is because that patient has way more ownership. They're not coming into a sterile clinic setting. They're in their own home. The stuff they're being given, they are doing it there and there, so they know they can do it. The exercise app is obviously supporting that, but they are so much more involved in the assessment process. So, what does it feel like? Does it feel this? Does it feel this? Right, what happens if you do that? Does that make a difference? And also the availability, so they're not having to take time out to actually go to a clinic. They can just, just turn my chair slightly, press a different thing, and it's there. So it's been a very interesting and rewarding journey, both from a clinical professional point of view, but actually from providing a customer service as well.
Great, thanks for that. So we have had a question in from Billy Hunt. So I think they're more, I think, sort of saying that they perhaps were coming to this webinar thinking it was going to be something slightly different. It's always difficult, isn't it, the messaging around webinars. So this has been geared towards kind of occupational health providers or people using those services. But they're asking, I think, just for any advice about how to help themselves in the working environment, because they're working from home in a caravan, so yeah, quite limited facilities, I think. And I suppose that you already indicate there are some kind of self-help resources out there, but have you, any other suggestions?
I think, Billy, I mean, I can see what you mean. You're coming at it from a slightly different perspective because it's sort of for yourself. But I think it's still, everything we've said is still very relevant. So I think the first thing to probably do is to maybe chat with your manager and just find out what support is available to you in-house with your employer. And as Colette said, loads of people haven't even flagged that there is an issue. So making sure that they are aware, if you're happy to disclose that and chat with them and say, look, you know, I am struggling and I'm having these symptoms, and just finding out what is available to them. And as we said, sometimes employers aren't aware of what they need. And so I think if you could take on board some of the things we've said and maybe go back to your employer and say, you know, I haven't had a home assessment. I am struggling. My health is impacting my work, or vice versa. And just to see if there is support with that, either by your occupational health department. I can see it's embedded into an NHS mental health team. So you may already have pathways into occupational health that you could access. But whilst you're doing that, you could then also go to the Health and Safety Exec website and look at their checklist, the self-assessment DSE checklist, and go through that yourself and take that through to your manager as well. And then I think the other thing we talked about around good working behaviours, so making sure you are getting up and moving and keeping active there as well. I can see you've said here, get support in getting me suitable chairs at home working, because I work for means you're living in a caravan. So that's where you're home to work. So yeah, we've seen people in all different environments, haven't we, Colette? And space is a difficult one. And what we have done with a couple of people who have absolutely no space is looking at folding tables, so small folding tables, and then looking at kind of really small seating if it will fit. But it's going to be very difficult perhaps in a caravan, depends how big your caravan is, the spacing to have that environment. But if you are working largely from home, and it is going to continue in the longer term, then I think personally it's important to try and figure out if you can get the kit in and what you can fit in that at What do you think?
No, I'd agree. You can get folding office chairs, believe it or not, but it is also looking at your day. And I often do this with clients, and actually look at your day, look at all your appointments and colour code them. Which ones do I absolutely have to sit because I'm referencing documents on my laptop? Which ones can I stand and take a call? And which ones can I walk around? And actually colour code them, so it's really easy reminder to actually go, this meeting I can stand up, or this meeting I can walk around and take the call. So you're getting more active that way. And I think also, obviously, space is a big limiting factor for many people. I mean, our contact details are there, so if you want to drop us a line, and we can help you in different ways as well, or make some suggestions to your employers. But in the immediate thing you can do today is look at how you can be more active during the day, and that would certainly help.
Great, thanks for that.
The ironing board is a goodie, yes. So yes, I have many people who are using an ironing board as a standing desk at the moment, or even as a normal desk. So there's always ways and means, but I think sometimes it is just looking at that diary and planning ahead.
Great. And then I think one last question we've had, is it possible to share the presentation and your home working guide? Well, certainly the presentation, this whole webinar is being recorded, so people will have access to that. I don't know about the home working guide, because I think that was something that you...
Yeah, if you could email us at info@bespokewellbeing.co.uk, that would be great, and then we can just share that back back with you. Yeah.
That's amazing. Thanks, Claire. Okay.
I can just see another question on the chat rather than the Q&A. There's a few people asking for the guide, which is great. And David's put, we currently loan out chairs to employees working at home, but we'll need them back once things we return to normal. We will be moving to flexible working for everyone, 3 to 4 days at home. Will we have to provide equipment on a permanent basis, especially if the HSC guidance changes? It's difficult. Everyone is trying to move with the times and move with the guidance. My feeling is that if that's going to be a long-term thing, so if you're asking people to work from home 3 to 4 days a week, so 1 or 2 days in the office, you need both of them set up appropriately, and you need to provide the equipment for them to do that safely, would be my stance with that. That's a large part of the working week. If you imagine, the HSC says, working for more than an hour a day on the computer classifies you as a DSE user, and then you're saying they're 3 or 4 days working from home, that flexible working, then I would say yes, that you would need to provide them that kit. Yeah, what would you think, Colette?
No, I agree, and it is all a bit unclear at the moment. So my understanding is that if it was in someone's contract that they are working from home, then the employer has to provide home working equipment. But obviously at the moment, everyone's contracts, I imagine, are all over the place. But you do have a duty of care and due diligence. So then it goes back to that, you have a duty of care to look after your employees. To be honest, I would look out at the cost of loaning and buying chairs, how long you think you're going to be doing this for. And you may actually find that if you buy chairs on bulk, it'll probably be pretty much a similar price to loaning or hiring. So that might be an option. And there's lots of ergonomic chair providers who I'm sure are very willing to do a deal. But it's very hazy at the moment, the legal requirements for providing kit, but you have a duty of care, and that's what it would always go back to.
And we have a lot of our customers have been searching for chairs that will do the job but are not crazy expensive. The cheapest one we found was £76.80, including delivery, and that was, I think, Andrews, and that's like just a basic task chair, office task chair. It goes up, goes down, with or without armrests that do adjust, a good size backrest. It's not one of those little dilly silly ones, and yeah, so it will do the job for a lot of people. I said like 80% of people just need the standard kit, but as Colette said, we've linked quite heavily with the equipment companies during this time, just because it's all been crazy, and they will do you a deal. If you went to them and said, I need 50 chairs, I want you to do them at £50-60 a chair, they will make it happen. We work really closely with Online Ergonomics, so if anyone wants me to intro you to Mark over there, then let me know. They will do you a deal. We've had so many customers where we've had to get large amounts of kit out, and they will definitely, they want to serve and help you, so they'll make it happen. They have their catalogues, but if you said, look, I've got 100 staff, I need 100 task chairs, go and I need it for this price, he will tell you whether he can get there or not. It's not going to be the most jazzy thing, is it, Colette? But it will do the job for a lot of people.
And that's it. And you don't have to spend, chairs can be so expensive. Just eye-wateringly expensive, and have lots of bits on there which you don't necessarily need. As Claire said, it just needs to go up and down, variable height armrests, ergonomically designed. I think the other thing is it must have that British kite mark on it. It must comply to the various ISO health and safety standards, and it must be ergonomically designed. And so, because the reasons being is that we're not sitting, it's not an occasional chair. You're sitting on it for 6 to 8 or plus hours a day, 2 to 5 days of the week. So it has to have that good quality behind it. But you don't need to spend hundreds and thousands of pounds on it. You can get out there. And as I said, which will fit for the vast majority of people. Goes back to our RAG rating, goes back to that baseline data. Who needs it right now, who's doing fine but needs it, and needs it for soon, and who's absolutely fine. So it does go back to that, getting that baseline data from your staff.
And there's also a comment here just saying, is it possible to please share the form for self-assessment and ergonomic assessments? I would just say, can you email us again, info@bespokewellbeing.co.uk. We're quite happy to share things, and we can show you kind of example of what an ergonomic report would look like. As I said, it's a lot more in depth. We spend a lot longer with the clients, and it's usually about 7 to 9 pages long with equipment advice. So if anyone wants any examples of what things that the two can look like, then please do just ping us an email and we'll share it.
That's fantastic, Claire. Thank you so much, and Colette. Really, really interesting session. I think we'll have to draw to a close there. So thanks everybody for attending. We will be sending out certificates of attendance within the next couple of days. And if you have any more questions after then, please just contact either Claire and Colette or Simply People, and we'll certainly get back to you. And also, if there's any other topics that you would like us to cover, please let us know. I just want to very quickly mention the other 2 webinars we've got coming up. On the 1st of December, there is one which is mental health, what are employers' obligations? So we have a lawyer who's sort of talking from that kind of what employers are obliged to support their staff around mental health. And then on the 3rd of December, there's one by someone from the Health and Safety Executive on the management of vibration. So very different kind of session on the 3rd of December. But the details are all on our website, which is simply-people.co.uk. So please do check that out if you haven't already. And thanks again for attending, and thanks very much to Claire and Colette for a really, really interesting session.
Thank you.
Bye,
Thank you
everyone.
for coming.
Okay, thanks everybody. Bye-bye.